Okay, good evening, everybody. Just want to thank you all for coming on tonight for our webinar on concussion awareness in Ladies Gaelic Football. My own name is Lizzie Flynn. I'm a National Development Officer with the Ladies Gaelic Football Association, and with me tonight I'm pleased to be joined by Dr Róisín Leahy. So Róisín has done a study on concussion in ladies football. So Róisín, if it's okay, I'm just going to hand over to you and maybe do your own little introduction and take us through the findings you had throughout the study.
Thanks, Lizzie, and thanks to everyone for attending. So as Lizzie said, I'm Róisín Leahy. I recently completed my PhD, which looked at ways to improve how we can diagnose and manage concussion in ladies Gaelic football. And I worked with my supervisors, Dr Keith Rossford, Dr Enda White and Dr Siobhan O'Connor from DCU on this. We also had the support of the LGFA throughout and the Irish Research Council. And we've put together a webinar for you guys tonight on concussion awareness in ladies Gaelic football, and I'm going to integrate some of my own findings into this as well.
Róisín, sorry, I should have just said as well, if any of the participants tonight that are on with us tonight would like to ask any questions, there is the Q&A function on it, and we'll get to as many of those questions if we can at the very end. Thank you. Back to you again.
Yeah, thanks, Lizzie. So as you all know, ladies Gaelic football is a deliberate non-contact sport, but contact can still occur between players or between players and the ball or players in the environment. And where you have a contact sport, there's going to be a risk of concussion. We can't get rid of it completely. However, one of the main messages I want to get across is that concussion is treatable, and there's a lot we can do to minimize the risks and treat the symptoms of concussion. So what exactly is a concussion? A concussion is a type of mild traumatic brain injury. It can be caused by a direct impact or an indirect impact to the head. So a direct impact would be just a hit to the head. An indirect impact could occur through a fall or something. So from my own research in a survey we did, we found that the vast majority of concussions in ladies footballers seem to be caused by direct impacts to the head. So it was about 95 or 96% of players we surveyed had received a direct impact to the head. So a concussion affects how the brain functions, but it doesn't actually cause physical brain damage. So if a player with a concussion gets a scan, usually there won't be any actual damage such as bleeding or bruising to the brain. And in most cases, the symptoms are temporary and short-term and resolve within 1 month. There are some players who take a bit longer, which we'll go into detail on in a bit. So what exactly is the current concussion situation in ladies Gaelic football? So part of my PhD involved a nationwide survey. So we surveyed over 650 adult players in Ireland from all different counties. We included county and club players at all different levels. So we were asking them about their experiences with concussion, basically. So we found that 10% of our respondents had been diagnosed with a concussion during the previous year. So we did the survey in 2020. The previous year was obviously 2019. And there were an additional 8% thought they had sustained a concussion but hadn't sought medical care. So these are people who maybe had a fall or hit to the head and had symptoms like headache or dizziness afterwards, but because they didn't actually go to a doctor or an athletic therapist or a physio, they're not 100% sure if it was a concussion. So we also found that of the 10% who were diagnosed, 24% returned to play on the same day, and 46% did not follow a return to play program. So a bit later on in the webinar, we'll talk about how you should manage a concussion, and it turns out two of the most important things are that you should not return to play on the same day, and that you should follow a graded return to play program. So we can see here, even among the players who have a confirmed diagnosis of concussion, who've gone to see medical personnel, a lot of them aren't actually managing it that well. So you might wonder, as a coach or a player, why do I need to know how to recognize and manage a concussion? There are a number of possible effects of concussion. So first of all, we have 10 to 15% of players who experience symptoms that last longer than 1 month. So as you can imagine, these symptoms are very disruptive and uncomfortable. They can also cause a delayed return to sport, academics and working activities. There's also an increased risk of injury associated with concussion. So this includes both musculoskeletal injuries, so anything like a ankle sprain or a hamstring strain, but also additional concussions as well. In particular, female players are at a slightly increased of a longer recovery than male players, which makes it important for ladies footballers, obviously. And another important point in a sport like ladies football, it's a community sport where often there won't be regular or good access to medical personnel. So that makes it extra important, I suppose, for the people involved in the sport to be able to at least recognize the initial signs and symptoms of a possible concussion. So I talked to Laurie Ryan last year about her experience with concussion. So she had a very bad concussion that lasted for a number of months, from what I remember. So she talked to me about how much of an effect it had in her life, not just sport, but work. So you can see, she said here, I ended up not being able to go to work anymore after that because I just couldn't do anything at work. I ended up not being able to obviously go watch training because I couldn't watch the ball. I wasn't able to really do anything because I wasn't able to deal with a group of people talking, and even my phone or anything like that was causing issues for my eyes. So basically lying down in a room was kind of the bones of what I could do. So you can see here the effect of concussion. It's not just that she couldn't play sport, she couldn't work, she couldn't even use her phone. So how can I recognize a possible concussion? It's important to note that there are some conditions which may appear like concussion that are more serious, so spinal injury or more severe brain injuries. So players who have any of these red flag signs should go to hospital immediately, just in case it's something worse than a concussion. So these red flag signs include neck pain or tenderness, double vision, weakness or tingling or burning in the arms and legs, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, or becoming increasingly restless, agitated, or comatose. Symptoms now are how a player feels, so they will experience them, but they won't be apparent necessarily to other people. And concussion symptoms can be categorized into 4 broad categories. These are cognitive or mental, physical, emotional, and sleep related. So the cognitive symptoms include difficulty concentrating or remembering, fatigue, feeling being slowed down or in a fog. Physical symptoms include headache or pressure in the head, neck pain, nausea, dizziness, vision problems, sensitivity to light or noise, and just a feeling of not feeling right. Emotional symptoms now include irritability, sadness, nervousness, and feeling more emotional. Finally, sleep-related symptoms can include drowsiness, difficulty falling asleep, sleeping more than usual, or sleeping less than usual. So concussion signs are how a player might act. So these are things that other people will notice, but the player may not necessarily be completely aware of them herself. So the main concussion signs are poor balance or a loss of coordination. She might clutch her head, slurred speech, vacant facial expression, vomiting, or loss of consciousness. So now that you know how to hopefully recognize a concussion, you're probably wondering, how can I manage a concussion? So I'll go through the immediate steps and then the more long-term steps. So if you think a player has a concussion, or if a player thinks she has a concussion herself, she should stop playing immediately. She should seek medical assistance. She should take a mental and physical rest for the first 48 hours, and she should minimize time using screens. On the other hand, she should not return to play on the day of injury. So if you remember the results from our survey, I mentioned a few slides ago that a quarter of players with a diagnosed concussion were actually going back to play on the same day as injury. So this is really not a good thing to do. So I'm just drawing your attention to that point in particular. Players also shouldn't drink alcohol or use any sort of recreational or prescription drugs which could mask the symptoms of concussion. And they also absolutely shouldn't drive. So that's the what you do on kind of the day after concussion. The return to play protocol is a graded way to get players back from rest to hopefully full match play. So this involves a series of steps that I'll go through in a moment. The idea is that the player progresses to each step after a certain amount of time, provided she has no symptoms that worsen at the current step. So it'll make more sense now when I go through it. At the start there, we have our 48 hours rest. So then if the player is symptom-free after this, she can go on to light activity, sport-specific activity, and non-contact training. So she will have to spend at least 4 days at each of these steps. And if she has no symptoms, she can progress to the next step after the 4 days. If her symptoms worsen, she'll have to stay at the same step until she improves. So then the player, if the player is medically returned, she can return to full contact play and then match play. And this, the Untitled return to play program should take at least 15 days from the day of injury to match play. However, in a lot of cases, it's going to take longer. The return to learn is a similar approach with getting players who are in school or in college back to education. However, it can also be used to return to work. It's just quite general principles. So after our initial rest, the player can start doing daily activities that don't provoke symptoms. She can then start school activities outside the classroom. She then return to school part-time, or even if it's possible to get any adjustments, so maybe not having to do homework, or taking if the busy environments like going to yards aggravate her, taking her lunch in a separate room. So just adjustments that can be made based on the individual. And then finally, of course, we have a return to school or work full-time. The link at the bottom will take you to more resources if people are interested. So another thing I looked at in my PhD was the factors that influence behaviour following concussion. So whether a player plays on, whether she follows the return to play program, and so on. So I looked at a number of possible things that I and my supervisors thought may affect how a player acts. So these were playing levels, so county versus the club level, age, whether the concussion was diagnosed or whether it was a suspected but possible concussion, number of years played, concussion history. We looked at knowledge and attitude measured using a questionnaire as well, and previous use of sports-related or concussion education material. So what we found actually that the main factor associated with behaviour was whether the concussion was a diagnosed or a suspected concussion. So those with a diagnosed concussion were more likely to follow the recommended guidelines. It's not surprising, however, it just really emphasises the importance of seeking medical care. Obviously, players and coaches need a certain amount of knowledge to be able to recognise if they have a concussion in a sport like ladies football, where there's probably not going to be, a doctor, athletic therapist, or physiotherapist on the sideline. So it's important that people have the knowledge, but also really important that players just don't think they should or can manage a concussion on their own. It's really important to go to someone. So Ava Rutledge from Dublin team had a bad concussion a couple of years ago. So I talked to her about this last year, and one thing she mentioned was that having understanding coaches and managers really helped her in her recovery. So she was out for a number of months So she emphasized the need for coaches to be aware of concussion. And you can see here, she said, the issue I found with concussion was that it wasn't a physical thing that people could see. I was very fortunate with all the coaches and managers that I had. They understood that, but I could see how sometimes coaches could forget that, oh, she actually has a concussion that's only a few days old. If that was someone who had just torn their hamstring a few days ago, you wouldn't expect them to play a match the next day. So this, I guess, shows why it's important for coaches as well to be aware of not only how to recognize a concussion, but be aware that the return to play progress may take a bit of time. So it should take at least the 15 days, but in many cases it will take longer. So the majority of players will recover within a month, as we said earlier. However, 10 to 15% won't. And in this case, they may need just a bit more targeted treatment. So the graded return to play program is very general. However, if a player is having prolonged symptoms, then we need to treat the type of symptoms they're having. So I will go into this in a bit more detail. Basically, we have our different categories of symptoms here, and the idea is that depending on what kind of symptom the player has, this should influence the type of treatment they get. So Ava, again, she had very bad headaches following concussion, and she found that every time she went back training or went to the gym, the concussion or the headaches just got worse again. So in the end, she ended up getting multidisciplinary treatment. So this involved migraine medication. She had medicinal Botox into her neck muscles, and she also did a stretching and strengthening regime in the gym. And she found that this was ultimately what helped her get back playing. So she said, probably about 2 months or maybe 6 or 7 weeks in, I gradually got back training again. So it did take a bit of time, but she found once she started doing the multidisciplinary treatment, she gradually began to improve. And similarly, Laurie Ryan had a lot of symptoms with dizziness and visual symptoms. So these are vestibular type symptoms. So she went to a vestibular therapist as part of her rehab. So this type of rehab treats symptoms such as dizziness, poor balance, and visual problems. So she was given sport-specific exercises to try and build up her coordination balance skills again. So one she described to me was where she had to begin with her back to the vestibular therapist, and then she had to jump around, say on a whistle, catch a ball, throw it back to the therapist, and jump around again. So it's obviously a very should be an easy task for an elite athlete, but after the concussion, she found this type of activity really difficult. So she said, initially I used to leave there crying every day because it was just so hard. I was working in slow motion. It was very challenging mentally. And I started to see little improvements, and it was very, very slow now, but they started to come. And then eventually this massive jump came. So again, like Ava, she had a lot of trouble getting back from the concussion initially, but when she found the right treatment, this helped her return. We just have a few more resources for clubs online. So with links there to post it, and we have some stuff on YouTube as well if people are interested. So we're just really at the end of this. So I guess our main take-home messages are that concussions happen in ladies football, so we can't prevent them. However, they're treatable. And it's important that everyone involved knows how to recognise the signs and symptoms of concussion. A player with a possible concussion should stop playing immediately, should seek medical attention, take rest for 48 hours. That should be mental and physical rest. She should follow a graded return to play program with guidance from a medical professional. And yeah, so that's really it. Thanks for attending. If there's any questions, I can take them now. I don't know if you want to moderate, Lizzie.
Yeah, fantastic. I've kind of more so comments in at the moment more than questions, but we might kind of touch back on them again, Róisín. I'd still say while we're maybe bringing those topics back up by some of the comments that came into me, if anyone has any other questions, please pop them in, because it's great to have somebody like Róisín, who has specifically looked at this in Ladies Gaelic football. Just I suppose one good question that did come in there was that, should ice ever be used on the head if there is swelling, was the question, or?
Yeah, I think it should be okay. Often with concussion there might be like a bruise or just like a bump as well, like to the skin. So yeah, I wouldn't see a problem with that. Just as long as like you wrap it in a towel or whatever.
Perfect. I suppose, so you can keep the questions coming. Just something I suppose that was touched on there earlier on is, it was really surprising. There was 2 or 3 comments in Róisín that people were surprised that females were at an increased risk of suffering from, I suppose, of a longer recovery period. So just, and I found myself that really something that was quite was new to me actually. So, and the other thing was, I think the symptoms. One other kind of had put into me there that the symptoms last longer than can potentially last longer than a month. That there's a general consensus, Róisín, I suppose, maybe with a cohort of coaches that, oh God, yeah, should they be back again maybe next week? And that's not always the case. Do you want to come in on that?
So definitely, like, they should not be back at full match play after a week, because they do have to go through the graded return to play thing. So even if they go through that perfectly, to get through all the stages, doing it properly, it's going to take the LGFA one says 15 days. So yeah, they shouldn't be back. They shouldn't be back after a week. Definitely not. They could be back, like they might be back doing a jog or some drills, but they shouldn't be playing a match.
Yeah, it's that contact. Again, another comment I put here in my notes around, I suppose there was a real awareness from listening to you there, going through the slides, Róisín, around the importance. I suppose we have a combination night of maybe, I'd say mainly coaches and players, but around the importance for our coaches to actually be aware of concussion, and that it's not just you need to maybe sit at home and rest for a couple of days, that it's a bit more. So that was just something that somebody had come in on as well there. So I don't know if you want to, I suppose you probably don't really need to go back through that again, but just I suppose just the importance of coaches being aware of this is huge, isn't it?
And even when I interviewed Ava last year, like she said, it was helpful that her coaches did have a good understanding, because she said she could understand how some players or some coaches might think the players should be back for the match next weekend, but they need to understand it's going to take a bit of time. And that was just one point she mentioned to me last year, which was interesting.
Yeah, and the last kind of, again, it was more of a point that came in across from one of the participants tonight, and that was around how surprising it was. I suppose you had 2, Laurie, I'm not sure was it Laurie or Eve, that had to, maybe get Botox injections to relax the muscles. That it was quite surprising that it's not just going back to that point, that it's not just, oh, they've concussion, they've got to rest for a few days. So again, I think there was a bit surprising that it's not just that we fit everybody into the same category or the same box, if that makes sense.
Yeah, so I suppose, like Connie said there, like the traditional thinking was that you just rest until it goes away, but there's more of an understanding now that people can experience different symptoms, and if people are getting prolonged symptoms, they should be treated differently based on what they're experiencing, kind of like I mentioned in the thing. But it's just important. I guess something, if there's anyone in the audience who is having trouble with a prolonged concussion, it's might be something they want to look into.
Great, fantastic. Was there anything else in there? I think some of the ones we kind of covered. And yes, look, this tonight will be recorded, so this will be made available on the YouTube channel for anyone who wants to come back and look at it again. And I would say as well that sometimes as coaches, as someone who's a coach myself and is a former player, that is something that our club coaches as well in particular should be made aware of. So I would say it's something that should be shared within the club. So look, I'll put one last call out to see if there's any other questions that maybe that we haven't covered there. So I see someone has raised their hand. So if you just want to pop that into maybe the chat, and we might, any questions you have, and we'll do our best to answer that before we finish up tonight. No, all good. Well, seeing as there's nothing else, just I suppose myself, Róisín, I just want to thank you very, very much for obviously taking the time out tonight to join us, to give us, I suppose, your own knowledge of concussion, and particularly, obviously, I think it's fantastic that to have this specifically, the findings relevant to our game is fantastic. So look, thank you very much, Róisín, and in particular, I want to thank everyone who has come on and joined us tonight for this fantastic webinar. All right, take care, everybody.
Oh, it looks like you might have a question there.
Okay. The last one. Can we get links? Yeah, I'll get the details and I will forward out the links to that in the next day or so. Eilish, yeah, absolutely. I'm not sure, was there anything else there? Great, I think that's everybody. Thanks very much, everybody. Take care.
Thank you.